Okay. Good afternoon, everyone.
Good afternoon.
Okay. Did you know that according to the 2023 Air Quality Index report, breathing the air in Lagos for just one day is equivalent to smoking 10 cigarettes? Yes. Before I discuss further, I am Zahira Aminu. I'm a data analyst with over a decade of experience. So imagine a rural student in Gombe, northern part of the country, straining to read by the light of a kerosene lamp, and a mother in Enugu, southern part of the country, inhaling toxic smoke as she cooks with firewood, while a young tech entrepreneur in the FCT spending half of his profits on diesel or petrol to generate electricity. You know, their lives are different, but their struggles are linked by two things: energy poverty and reliance on dirty energy. So today, I'll be presenting to you the health impact of dirty energy in Nigeria. Okay, Nigeria faces a dual challenge of energy poverty and reliance on dirty energy. So this reliance is not just an environmental crisis, but also a public health emergency. So according to the IEA, International Energy Agency 2023, about 90 million Nigerians lack access to electricity, and over 175 million Nigerians rely on solid biomass for cooking. In addition, World Health Organization 2021 revealed that every year, over 100,000 deaths are caused by household air pollution. Why? Because over 70% of our households lack access to electricity, as revealed by World Bank 2022. So what are these common sources of dirty energy? One is biomass. Biomass is mainly firewood, charcoal, animal waste, agricultural residues that are used for cooking, water heating, and other uses. And this is used in rural and peri-urban households. Secondly, kerosene. Kerosene is usually used for cooking and lighting, and it's used by low-income households. The third source is diesel and petrol generators, which are used for electricity generation by businesses and homes due to the instability of our national grid. So the use of this dirty energy has some health impact, negative impact. So the first one is indoor air pollution. Smoke from firewood, charcoal, and kerosene stoves is a leading cause of respiratory diseases such as asthma, lung cancer, eye irritation, and cataracts. In addition, a study by Okedere et al. 2020 pointed out that PM 2.5, which is a pollutant that is being emitted when you burn these dirty fuels. So the levels of that PM 2.5 in Nigerian households that use firewood exceeds the World Health Organization safety limit by 500%, which increasing the risk of bronchitis and pneumonia in children under 5. So the second impact is outdoor pollution. Generators and old vehicles emit fine particulate matter, that is the PM, and other pollutants. So this pollutant cause the cardiovascular diseases like high blood pressure, heart attack, stroke. In addition, a study by Eboha et al. 2019 revealed that long-term exposure to generator fumes in urban areas like Lagos and Port Harcourt has been linked to increased cases of heart failure. So the third impact is gendered health burden. According to the UNDP 2021 and also Indica et al., in Nigeria, women and children are the most affected by these dirty fuels because of their prolonged exposure in kitchen and near cooking spaces. So in order to mitigate this health risk, one, government should promote clean cooking This can be done by expanding access to clean energy sources like LP, that is our cooking gas, biogas, and also technologies like improved wood stoves. This can be done through subsidies and also awareness. The second recommendation is government should invest more in off-grid solar and also mini-grid. This is to reduce the need for petrol and diesel generators. The third recommendation is government should strengthen public environmental health policy by integrating pollution-related diseases into public health surveillance and also primary care. So in conclusion, dirty energy sources pose serious health risk in Nigeria. So there is need for urgent transition to clean energy in order to save lives and reduce disease burdens. This is also corroborated by IEA, that is International Energy Agency, 2022, that transitioning to renewable energy could prevent over 50,000 premature deaths in Nigeria. Thank you all for listening.